Mr. Tenaglia, how much on average does the military spend on Viagra each year?
I don't have that figure, ma'am.
About 41.6 million. Do you know how many bridges in my district of Pittsburgh could be repaired with that amount? About 2. My Republican colleagues pretend that DACA recipients are not already here, paying taxes, picking up kids from school, and accessing our public health system. This fix not only helps people who have legal status in our country, but all Americans. We are one of the only Western nations that doesn't have universal health care. Republicans would rather invade sovereign nations and line the pockets of war-profiteering friends than spend a single penny actually helping Americans suffering from addiction. Republicans want to control what books you read. They want to control what history you learn. They want to control how you identify, who you can love. They want to control our bodies. They want to control everything except that which could prevent mass preventable deaths of children and students and worshipers and shoppers in the only country on earth that this is a problem. I rise today on behalf of the students, teachers, parents, and loved ones across Western PA who are still reeling from what we all thought was our worst fear come to life today. Just days after families in Nashville went through an unimaginable hell of losing their 9-year-old children because they had the audacity to attend a school in America, we received word about an active shooter situation back home in Pittsburgh. First at Central Catholic High School, then Oakland Catholic High School, and eventually a dozen of our schools across Pennsylvania. Imagine, you're a kid in Central Catholic. You've gone through the active shooter drills, and you saw the news on Monday and heard about every school shooting prior, and today you get a text that a gunman has entered your school. You're wondering if you'll be shot. Will it be your friends who are shot, your classmate, your teammate, your teacher? Can you protect them, or should you run? Do you have time to text your parents one last time? Imagine you're a teacher hysterically crying to the dispatcher a minute after you heard the news. You realize the lock on your door is broken, so you start building barricades with desks and chairs. You ask your students to protect themselves with whatever means possible, from the metal rod in the closet to the acid chemicals in the physics lab. It doesn't have to be this way, and it wouldn't be this way, but it is this way because Republicans care more about guns than our kids or worshipers in a church or a synagogue or shoppers in a Walmart. They will not control the proliferation of guns in this country. And for those of you who say it's too political to ask that we put an end to bullet-ridden babies in body bags and traumatized kids doing active shooter drills in their elementary schools, I ask you to stop putting your politics over our children's lives. I yield back. I want to thank the joint subcommittees for holding this hearing on the financial mismanagement of the Department of Defense. I think this is one of the few areas where I can agree with my Republican colleagues on the need and nature of this oversight. When we dedicate so many of our resources to our military while we nickel and dime our other programs, the least we are owed is transparency and accountability. When our country spends more on defense than the next 10 countries combined, we rightfully have high expectations for how that department functions. Yet, year after year, we shovel billions their way, 15% of our total budget. We continue to be disappointed, and the American people are let down. Mr. Tenaglia, how much did the 2023 National Defense Authorization Act authorized for shipbuilding?
I do not have that particular figure.
Yeah.
The total amount of contract obligations in 2022 was over $400 billion.
For shipbuilding, it authorized $32.6 billion. Do you know how many school lunches that amount could provide to hungry children in America, where for the 1 in 8 children who go to school hungry, that may be the only meal they get? All of them, and then some. The school lunch program cost $28.7 billion in 2022. In 2019, this committee led a bipartisan hearing to hold military contractors TransDigm, accountable for its exorbitant profits on DoD contracts for spare parts. This pressure led to TransDigm repaying DoD $16.1 million. Last Congress, this committee held a second hearing, again on the excess profits that TransDigm received. I'll note that my Republican colleagues did not join our call for TransDigm to repay its excess profits, even though TransDigm has a track record of fleecing American taxpayers. TransDigm likes to acquire companies with sole source DoD contracts and then exploit its monopoly position by hiking up prices on crucial spare parts. Mr. Tenaglia, what policy changes is DoD considering to prevent price gouging on sole source contracts, and are there specific legislative reforms that would assist this effort?
So as I indicated in my written statement, Section 803 of the FY23 NDAA helps us in that regard. It will require contractors to provide the transparent cost and pricing data that we need. In the case of commercial items, likely that will be uncertified information, but by the same token, our contracting officers need access to that information in order to establish fair and reasonable price.
Thank you. It's my time, but I want to say I urge the department to do better. Your department accounts for 15% of the total budget. You need to be more mindful in not only how you spend America's tax dollars, but also how you account for it. Millions of dollars should not just be lost, and failing audits should not be the norm. That is unacceptable. I yield back. What we are talking about today is a proposed rule to extend Affordable Care Act benefits to an estimated 129,000 uninsured DACA recipients. And make no mistake, these individuals are still getting sick and going to taxpayer-funded clinics and emergency rooms. But just like everyone else in this country, they deserve more than just emergency care. They deserve affordable prescription drugs and access to comprehensive health care and preventative treatments. Dr. Mons, knowing that many DACA recipients already rely on our health care system, why would it be beneficial to expand their access to affordable insurance?
Thank you for that question. As I said, there are multiple benefits to being insured versus uninsured, including healthier, more productive life, your limited risk of receiving high medical bills that you're not able to pay for that then are incurred by the health insurance system.
Let me ask, when we're talking about the expansion of Medicaid, who would it apply to and about how many people would that include?
Our proposed rule estimates that in the roughly 35 states that have elected this option under CHIPRA 214 to cover pregnant individuals and children who are lawfully residing, that would extend coverage to about 13,000 individuals. 13,000
individuals. Would those states be required to expand health care coverage for Medicaid?
The CHIPRA 214 coverage option is an option for states. They are allowed to cover or not cover lawfully residing.
Thank you. Just to conclude, the Affordable Care Act takes important steps to ensure that people are not denied basic health care because of their gender, disability status, zip code, or income. But we still need Medicare for all, and we will keep fighting for it. Thank you so much, Madam Chair. And thank you so much to the panel. I appreciate the seriousness and the urgency of this topic, but I do question sometimes the way that we use our time and our resources in this committee. We spent all morning talking about waste and fraud and abuse and our government programs, yet this hearing feels like we are not always getting to the heart of the matter. And it feels like sometimes we spend more time looking to create a boogeyman or for a boogeyman than we do looking for humane and proven solutions. And this is not a laughing matter. The opioid crisis facing this country is a real, legitimate threat. Since 1999, drug overdoses have killed over 1 million Americans. That's far higher than the 58,222 and 20 American troops killed during the Vietnam War. In my home city of Pittsburgh, more than 1,590 people have died from drug overdoses since January 2021. And we're in this subcommittee chasing our tails and listening to another hearing on China. What are we really going to do about this? Former President Trump has discussed sending special forces to target cartel leaders and is apparently seeking battle plans to strike Mexico. Republican congressmen have introduced a bill to authorize the use of military force to put us at war with cartels, and senators have indicated that they're open to sending U.S. troops to Mexico, even without that nation's permission.